Council that was unveiled is expected to establish systems for malaria elimination in target counties, which are mainly found in the Lake Victoria region, the coast and some highland areas. Our health and science reporter Beldin Waleula was at this event and filed the story.
Malaria is the top killer of children under 5 years, and it accounts for 15% of all hospital visits in Kenya. The Malaria Council, therefore, is to provide leadership if Kenya is to be a malaria-free zone.
In the early 2000s, we used to get a lot of malaria outbreaks being reported, even in the media. And hospitals being full of cases of malaria. But we hardly get that now with just isolated cases. For example, we have emerging cases like in sub-counties like Loima sub-county in Turkana or Tiati sub-county in Baringo.
Malaria, the 7th highest cause of death in the country, puts 36 million Kenyans at a risk of infection. The high-risk areas are counties around Lake Victoria, which have a prevalence of 27%, and the coast at 8%. Highland areas, arid and semi-arid, which get seasonal outbreaks, and the central part of the country are low-risk areas.
The greatest burden, as was ably demonstrated here in the presentation, is in Busia and Siaya, where incidence is more than 6 times higher than the national average.
Kenya, like other African countries, are still lagging behind in ending the disease. Kenya's malaria strategy is to reduce malaria deaths and incidences by at least 75% by the year 2023.
There were 215 million malaria cases and 384,000 malaria deaths in Africa in 2019. It concerns us, therefore, that malaria incident rates in Africa has plateaued since 2015.
This year we are targeting to distribute 15.7 million mosquito nets. It's a process that we have already started by planning with all the counties. This is in 27 counties. We have already planned with all the counties, and the next step is to go ahead and distribute the nets. These nets are distributed. We target to capture around 27 million people to sleep under a net after this campaign.
Apart from the nets, the 4th dose of RTA malaria vaccine pilot began in 8 counties around Lake Victoria Basin, the outcome of which will be shared mid this year. Belden Waliaula, KTN News.
Now, we want to have a conversation in that situation on malaria. Where exactly are we in the fight against malaria? And joining me via Zoom is Dr. Victor Ngani, who is the medical director at RFH. Thank you very much for joining us here on Bottomline Africa. Maybe we could start by just painting a situation of what's happening in medical hospitals, especially in regards to malaria, at a time where we're fighting the COVID-19 pandemic.
Thank you very much, and thank you for having me in this show. Indeed, malaria is one of those diseases that has proven to be a challenge. It's a disease that is preventable and curable. Yet in Kenya today, more than 3.5 million people get malaria every single year, and up to 10,700 deaths are recorded every year. That is over 20 people dying every single day in 2021 as a result of malaria. And indeed, the reporter pointed out correctly that for those children under 5 years, a category that we're losing over 74,000 children in, that age group, the leading cause of mortality is malaria. So it's one of those conditions that ideally with significant effort could do a lot better, but it's causing significant morbidity, mortality, and just lots of losses for families across this country.
It's interesting that you've brought up the issue of children. I remember malaria vaccine had been recommended by WHO for pilot introduction in selected areas such as Ghana. Same thing in Kenya. This was supposed to be the silver bullet, for lack of a better term, in terms of solving this malaria issue. Is this the case?
Well, vaccination is always a solution to, well, it's an added advantage to any healthcare problem. In fact, with regards to diseases, if you can prevent the disease, is a far better, a far safer, and a far cheaper option than any alternative. However, as with all vaccines, you expect efficacy levels to be different. It will not cover everybody, and it doesn't mean that you become 100% immune from malaria. However, the fact that we're having a trial of a malaria vaccine is a huge milestone. It's something that has been elusive for almost 100 years, and now suddenly we're in trial stages, not just in Kenya, but in Ghana and in Malawi. It's a rollout that should have been there back in 2019, as far back as August, but there were a couple of delays, and now that we're rolling it out, we'll wait and see how it works. However, it doesn't take away the need for other measures, controlling mosquitoes and just making sure that our health systems are robust in preventative measures and also in curative measures.
All right, before we get to the measures, I just want us to talk about this fight against malaria. It seems to have stalled or slowed down. Why exactly is Africa bearing this brunt of this disease?
Well, many reasons. So the first thing is that malaria is transmitted by mosquitoes. Mosquitoes love damp areas, swampy areas, they love bushes, and Africa has been blessed in this way that we have significant rainforests, we have lots of rain. Of course, it's been a bit lower this last couple of years, but then this together means that we have a high burden of mosquitoes. But then there are public health measures that could have been taken to reduce that burden, and also just the risk of transmitting the disease would have been reduced to some degree. Then, of course, once someone has malaria, if our health systems were a bit more robust, then we'd have fewer mortalities. So at the end of the day, that's the most important part. And Africa, as a continent, has struggled in setting up systems that work for our general public. Yes, the private hospitals may be doing much better, but then this is not a burden for those who can go to private only. This is a burden for every single person, and the solutions should be within reach for every single person.
All right, let's talk about that council that was unveiled yesterday and some of the measures that were immediately going to be implemented were supplying mosquito nets in 27 counties, targeting a population of about 27 million Kenyans, and also spraying of mosquito breeding sites. Is this enough?
Well, I would say it's a start, and I'll say this because a key factor in any initiative that would work is political will. But political will is not enough. You need to have the policy entrepreneurs, those who go out and actually implement and believe in what is being done, and then the actual action on the ground. If we are of singular mind in using the available resources to target malaria as a disease and actually work towards an actual vision of 2030 that eradicates malaria, then we can do it. The challenge is our history, where many of these good initiatives then just become stories that we discuss. In between, then the resources, have other priorities and things like that. Now, of course, the measures that have been stated by themselves not enough, but they go a long way in reducing the disease burden. You'd asked me earlier why we've seen maybe some increases. Priorities have changed over time, and if we have programs that are largely depend on donors, then we find ourselves quite exposed if donor funding goes down. And therefore, it's important for us as African countries to set up our own structures that allow for progress in terms of curative measures. Let's take our own healthcare in our own hands, allocate resources. So yes, it's a very good thing that there is a board, there is a council that has been set up because it demonstrates political will. And this is a first step in the triad of three things that ought to be done to create attraction and get us where we're supposed to be.
All right, Doc, as we wind up, the issue of eradicating malaria by 2030. Fighting malaria is something that has been going on for years. How possible is this?
Well, it is ambitious, and I'm glad you're hitting the nail on the head. 2030 is quite ambitious. Let's not say whether it's possible or not. What I'd ask is that let's give it our best effort. Let it be concerted. Let the team that's been tasked to get this done go ahead and give it their best shot. Let us focus on prospering individually by making this a success. Let there be a good name in this situation, better than money, because if we allocate those resources to this fight, if you have singular mind where every available, all hands come on deck to reduce the malaria burden, then even if we don't eradicate it, that number we are citing, 10,700 deaths every year, will go down to below 2,000 for sure. And that's a massive win for this country.
All right. Thank you very much, Dr. Victor.